from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It is Thursday, March 3rd. I'm Alexis Delcid. Welcome to All Things Heart. Every Thursday at 10 a.m., we're here for you. We are exploring and explaining how everything connects to our hearts. Today, you'll meet Becky. Becky's heart made her cancer diagnosis even more difficult. How our cardio-oncologist tackled the surprise complication. And what is a cardio-oncologist anyway? Well, you are in luck. We have the esteemed Dr. Charlie Porter here to enlighten us on his specialty. Speaking of Dr. Porter, yes, his passion is treating the heart, but he has another passion, and it is beautiful. We're going to take you behind the lens and show you. And do you know your risk? We're going to tell you the 4 things you need to know to be heart healthy. As always, if you have a question or a comment, please share those with us. You have direct access to our doctors on the show. You can post your questions or comments on Facebook, YouTube, or email us at allthingsheart@kumc.edu. And now to Becky. A cancer diagnosis in itself, well, that's enough to rock anyone's world. But now imagine this. You go to discuss the treatment options and you get another piece of stunning news. You have a heart condition you never knew you had. That heart condition makes the very treatment of your cancer potentially deadly. So what do? It happened to Becky Smouse. If there was a Jeopardy category, she lives life to the fullest. The correct answer would be, who is Becky Smouse?
I just like to have fun. I don't think I know how to relax.
Whether it's cheering on the Chiefs or sporting KC, nights out with her beloved family and friends, or vacationing poolside or snowside with her 2 kiddos and husband Brian, Becky was living it up as usual. But in 2015, just 2 weeks before her 38th birthday, she noticed a small marble-sized lump along her left collarbone.
It was a very surreal experience. I think I felt that I knew I had it before my diagnosis.
It wound up being what any of us would dread after finding a lump, cancer. But Becky, always looking on the bright side, says she was relieved to find it was Hodgkin's lymphoma, one of the most treatable kinds of cancer with a very high survival rate. But life was about to test Becky's positivity and faith a little more. During all the testing before her chemo, doctors discovered she had a heart condition she never knew about.
So once I did the echo, the ejection fraction, which is essentially how hard your heart is pumping, was at a lower level than normal.
It meant the chemotherapy to knock out the cancer could also cause Becky's heart to fail. Becky would now have to be under the watchful eye and care of a cardio-oncologist.
Becky was the most difficult case.
Enter Dr. Charlie Porter.
He's a bit quirky, but I love it. You know, he's got his glasses and he's telling me all these studies and how I'm such an interesting case study because, you know, I'm 38 and healthy and had no problems before. Like, how does this happen? Definitely fun. I loved meeting him.
And I just get the feeling that had we been in the same grade in class, we'd have probably sat close to each other in the back of the school bus and we'd have gotten the same jokes.
With his easygoing personality, sensitivity, sense of humor, and the ability to explain medical terms in plain language, Becky says Dr. Porter was even able to calm down her mom, who was worried sick.
Well, I just explained to people that this is a rocky road, but it's better to take a rocky road to safety than a smooth road off a cliff.
There were no guarantees, but Dr. Porter promised his treatment plan would minimize her risks as much as possible while still allowing the rest of the oncology team to give Becky a fighting chance. The stakes were sky high. The road ahead would be grueling, but with a family that desperately loved and needed her, Becky had every motivation to press on. And we are so excited to welcome Becky and Dr. Porter to our show. Becky is joining us from home virtually. Dr. Porter is here in studio. It is so good to see you both here back together virtually. Dr. Porter, is there tears in your eyes?
I'm not commenting. I've had a lot of eye surgeries. They leak sometimes. But it's fun. It's amazing to hear her side of the story.
Yeah. I can tell it really moved you when Becky talked about her bond with you, and that must feel amazing to see her on the other side.
Yeah, no, it's really good. And when I went into cardiology, I didn't realize, the interpersonal stuff. I went in for the technical, the ICU, the angioplasty, and stuff like that. And it just didn't. This stuff where you're face to face with people and you get to know them, it's just different, and it changes the decision making. You have to stay detached in your decision making, but attached to understand how people feel while you're talking to them.
I can't imagine the juggling act of having to have that balance. I want to grab you a tissue, but while I do that, I want to ask Becky. Becky, how are you feeling today? And the cancer is gone. You are cancer free, right?
I am. Good morning.
Good
Definitely
morning.
gone and feeling great. Glad to be here. Glad to share my story and help others in my situation.
Dr. Porter, I want to ask you, is Becky's story, it's okay, you can wipe your eyes during this, You're human. I mean, that's why we love you, and we love seeing these stories, because there is no magic way to separate the person that you're feeling this bond with, that you're saving her life. And so there must be an emotional investment in that. Was her story a rare story for you, or is this a typical kind of patient that you would get?
No, she had issues I had not faced before. I mean, I knew what they would be, but as I recall, I saw her on a Tuesday, and she was scheduled for chemotherapy on Thursday, and they wanted me to say go or no go. And the thing about the treatment she had with this drug called adriamycin, or it's been known not exactly affectionately since it first came out in the 60s as the Red Devil.
The Red Devil is
Yes.
the kind of treatment that Becky was going to
Right,
get.
and that's how everybody has heard that term. So when you're talking about cancer treatment, even years back, you just say, "Did you get the Red Devil?" They'll go, "Oh yeah, they were talking about that."
Did Becky, did you know it was called the Red Devil?
I did. And there are
Was that-
specific reasons it's called the Red Devil.
And it's called that because it can be so taxing on your body?
Yeah, it's one of it really has the most direct, adverse, some potentially irreversible on the effect on the heart of anything. But
Wow.
it first came out in 1967 in children, and was the first thing that gave children with leukemia a chance to survive at all. And even in the first studies, they said heart failure, shock, low blood pressure have been seen, but the cause isn't understood. I mean, it was so good they didn't really care, because people were living. And now 50 years later, it's still in use, and we have a lot better understanding of who's at risk and how to manage it.
I want to ask you about cardio-oncology, and I want to make sure I get this right. You were the first cardio-oncologist in the whole region, and you founded the cardio-oncology program here at the University of Kansas Health System. So my question for you is, I had never heard of cardio-oncology, and you say most people haven't until they need it or they meet you. I mean, unless they're working in a hospital system. So what is it?
Well, cardio-oncology is the study at many levels, molecular, genetic, clinical, a study of the effects of cancer, and specifically cancer treatment on the heart. And on the clinical side, it's how do you get, the most important thing is how do you get people through cancer treatment when the cancer treatment can be directly impactful on the heart, particularly in situations where there are fatal outcomes from the cancer treatment related to heart disease.
And Becky, this question is for you. Did you have any symptoms of a heart condition that you can see now looking back that you might have ignored?
No, I had no idea that this existed at all.
So it was only through the testing and the evaluations they do before you get the Red Devil treatment that they said, wait, you have a heart condition.
yes, I was stunned. I was ready
Wow.
to do chemo and go in, and that day they had my baseline tests come back and said, whoa, we need to stop here. We can't start chemo until you've seen a cardiologist.
So Dr. Porter, what did Becky have exactly wrong with her heart, if you can explain it in terms that the regular people would understand? And then would she have been able to live with that, and it was just discovered because she happened to get tested for something else?
She discovered that because of the workup for the treatment for her lymphoma. And ordinarily what happens in this situation, she had an echo and it had an EF under the normal range, clearly under the normal range. And then, so the reflex, when you see a test like that that doesn't fit with everything else, is you get another test to say, well, that was just a bad hair day for that test, or
Right.
we'll throw it out. But the second test, which used a totally different technique, came back with the same number. So then you couldn't say, rounding error, it's wrong, you're okay, go ahead. So she had two numbers that were both in a range that were below the ejection fraction point where there was guidance or acceptability for using adriamycin in her situation.
Would she have been able to live with that heart condition were it not for having to get it treated for the chemo?
Yes, and
Okay.
had she had that done because somebody gave her a free echo for her birthday or something, and that's
Right.
not a great gift, but if she had just had the echo for some other reason, she had seen that, she would have seen a cardiologist who works with weaker hearts, and they would have taken a routine approach over several weeks to casually increase these medications and expect that the heart within 3 months would look fine.
Okay.
And that would have been her expectation. But then ordinarily what you have is 3 months and all you're doing is saying, oh, we're casually doing this.
Right.
It's like, okay, we'll just work you up. With 3 months, you're feeling fine. You can do what no big deal. But I saw her on Tuesday and she needed cancer treatment on Thursday.
She did not have 3 months.
That's way
Right.
less than 3 months. And you have to decide what to do and whether to interfere with the cancer treatment.
So what did you do?
Well, I started her on the standard drugs that are used for heart failure, and because when you're talking about risk factors, she had everything favorable with her age, non-smoking, exercise. I mean, didn't have diabetes, did not have high blood pressure.
And we have a picture of risk factors that you told us about. So when we talk about this, I want to talk about the risk factors that you're saying. She did not
Have any of
have
those.
these? So she had none of the risk factors.
Right. I mean, this is just not fair. It's like, you're
Wow.
raising your kids. They say, Mom, that's not fair. And, then you tell your kids, well, you have to learn life's not fair. But, unfortunately, sometimes when you're an adult, you find out the hard way, life's not fair to you either. And this is just, it strikes out of the blue. But there are things to do. But this convergence of high risk, high benefit cancer treatment
Right.
and the withdrawal of the adriamycin substantially reduces her chance of remission or cure. Hodgkin's Hodgkin's lymphoma is not a common form of lymphoma, but all other lymphomas are clustered under non-Hodgkin lymphoma. It's if you get the right treatment, you're highly likely it gets into the rearview mirror in life pretty
Right.
fast, and you just move on. You have some. You have some things that are left over, risk for the future, but there is a future. But the adriamycin is a necessary part of getting that treatment up to the point where it's high survival. And I liked oncology as a resident, but I chose cardiology because, this is exactly why I didn't go into oncology, because I said I do not have the fortitude to take care of 40-year-old people with kids who I think are probably going to die of their cancer.
Oh.
So I went into cardiology because at that time in my 30s I thought, well, I couldn't stand the 40-year-olds, getting sick and dying, but those 65-year-old guys, they're
grim.
old,
Right?
forget about them, attitude about that age group is different now, but
you have a whole different perspective as we all move into different decades,
I have
right?
the same perspective I do about 40-year-old people with kids not being able to be the mother of the bride. You know, that's still tough, but the survival rates are better, and cardio-oncology allows us in the field of cardiology to guide people through so they do get over that big hump of toxicity for cancer treatment.
Thank God for experts like you, and thank God that you and your specialty met Becky's in her health journey. I want to ask Becky a specific question because Becky, you know, Dr. Porter is saying if someone had gotten you an echocardiogram for your birthday, you might have had something flagged, or maybe if you'd had a doctor, they might have noticed things, but you've admitted with a lot of chagrin that you did not have a primary care doctor and didn't go to regular checkups for yourself. You took great care of your kids, though, and your whole family. How is that possible?
That's a very good question. And I tell everyone that I meet to not be like me at that age. You're just busy. You have a second grader and a fourth grader. You're taking them to their appointments. You know, we're involved in youth sports. We're involved in church. We are working. You know, you have a social life. I don't like to be bored. So, you know, no one wants to take time off work to go to a doctor's appointment when you look and feel healthy.
I'll speak up on Becky's behalf because I was for quite a while I was making my annual visit to the doctor once every 10 years, but I've ramped that up.
Even as a cardio-oncologist?
Well, I wasn't that then, but as a physician, you know, I mean, I knew what to look for. I was doing stuff, and I was busy too. I mean, how do I get time to have a doctor's a doctor's visit?
But you'd never skip one for your kid.
No.
Yeah, we would never skip one, or we'd make our spouses go to their doctor's appointments. I mean, I have to say I'm guilty of that too.
Well, married guys live longer.
What's that?
Married men live longer.
That's a good point.
It's been studied.
Yes. Well, you and I have talked about that as well. I have a question about lymphomas. Are lymphomas the most common form of cancer that carry a heart risk?
No, they're not. And non-Hodgkin lymphoma is in the top 10 frequency, but that covers a lot more types of lymphomas. Hodgkin lymphoma is less common, but still it's one of the forms of cancer treatment that requires the red devil, the anthracycline for most cases. And and there are other treatments, but there's a drop-off in survival with these other treatments. And the oncologists are very rigorous about this because if you reduce the dose or you say, let's just give it to you, let's spread it out and not give it to you as in this, this rapid-fire, intense manner, that's like going to a boxing match and instead of saying, I'm going to hit my opponent 4 times in the head in the first round, you're going to say, I'm going to hit him 1 time in the head every 3 rounds. Well, that's not a knockout.
Right.
So they want it, there's only one way to do this right, and that's the way that produces these high survival rates. So, you know, it's
and there's
you have to punch, you have to understand, and that's one of the things I have to do is because I don't, cardiologists, generally, if something's causing damage to the heart, you say, stop doing it, you know.
Right.
So, but this, you can't say stop doing it.
Because it's cancer treatment.
Because it's cancer treatment. So this is where you have to learn, and I've coined the term permissive cardiotoxicity. So you have to permit and oversee cardiotoxicity that otherwise in every other form of cardiotoxicity, you say just quit doing it. My orthopedic surgeon, you know, when I tell him, an orthopedist friend, I tell him my shoulder hurts when I play tennis. Well, quit playing tennis.
Right.
Well, no.
Doc, it hurts when I do this. Don't do that.
No, well, I'm not going to quit playing tennis. So.
Right. Where does breast cancer fall into this? You sent me an interesting graphic on breast cancer and the rates of that compared to lymphomas.
Well, it's the most common. Breast cancer is the most common cancer in women. Prostate cancer is the most common cancer in men. And interestingly, they're both hormonally driven. And one of the mainstays amongst the most common form of breast cancer is hormonal treatment. But lymphoma has a higher incidence of requiring cardiotoxic anthracycline than breast cancer. It's actually, breast cancer is common, but there are a multitude of other treatments now, so that the likelihood of needing anthracycline for breast cancer is less than the likelihood of needing it for lymphoma.
Okay.
But either way, you face issues.
Becky said that when, Becky, you told me you were expecting when you came to the University of Kansas Health System, you thought you were going to get one cancer doctor. And we all expect maybe one doctor, but you were stunned when this whole team comes in, and there's a team of people, including Dr. Porter. Can you talk about how surprised you were?
Of course. I mean, you get a cancer diagnosis, and so you think, okay, I'm going to get an oncologist and the nurses and coordinators and other team members that come with that. But, you have your baseline test. So I had a heart test, I had a lung test. I was very special throughout my entire process. And so from the beginning, I got Dr. Porter and his team, which definitely was a surprise. Like, okay, how do we go from here? Pivot once more. And then as my treatment progressed, I had a few other things. I got to see an infectious disease doctor at KU, and then I had some lung issues after my treatment. So then I got to see the pulmonary team. So it was amazing to have KU and all of the connections and everything right there. I never had to wait. They were a team. They shared the notes. They talked to the doctor. So when I went in there, they knew exactly what they were dealing with, and they were ready to handle it all without any kind of heartburn on my end to get it scheduled and understand and coordinate.
Since I have Dr. Porter right here, he's trapped. I want you to talk a little bit more about your relationship with Dr. Porter, because something that I found so interesting when I was talking on the phone with you during our conversations is you always use the word fun when you describe your interactions with Dr. Porter. Becky, no one on earth that I've ever interviewed has talked about anything related to their cancer journey as fun. So can you explain a little bit about what it is about this guy that makes you actually look forward to seeing him when you're being treated for cancer and a heart condition?
Right. I think Dr. Porter definitely has bedside manner, and he gives a piece of him to you as well. So before the show started, I'm asking him about his next trip and where he's going. I think later in the episode, we're going to talk about his passion, which he's shared with me as well. So he's
Don't give
very
that away
open.
Yet.
No, I didn't give it away, but he's very open to sharing himself with me, which makes it very easy for me to share myself. And I'm an open book to begin with, and I kind of call it like it is, sometimes for better or for worse. So I guess if you're going to see someone, every week, you might as well make the best of it and go from there. And he definitely had my best interest in heart. You could tell he was concerned and trying to figure out what we needed to do. And he was upfront, that this is not a normal case. We're going to, we might have to adjust as we go through. So I appreciate all of that. I want honesty and personal care, and that's what I got with Dr. Porter.
You're making us all sniffly right now, Becky. I want to get to some community questions because I've been getting some emails and some private messages from people on my Facebook page. So I want to start with Denise. Denise wants to know, Becky, how has being a cancer survivor changed your life and how you live during a pandemic?
This is a great question. I think there's two trains of thoughts from a cancer survivor, any kind of medical survivor. So I personally chose the route of, we were very cautious. We did not do much. My kids did remote learning last year. So we stayed home. We got our immunizations. We were cautious, but I was cautious because I knew how precious life could be, and that if I just kind of hung out for a little bit, it'd give me a lot of life down the road. I also completely understand those who chose the opposite route, where, hey, I know that not every day is given, so I'm going to take this day that I have and not waste it. So I think it's a personal preference, really.
I have another question from one of our Facebook viewers, Lynn Painter, who just wrote in, will she have any ongoing long-term effects following her treatment? I'll give that to Becky first, and then I'll ask Dr. Porter. Do you have any long-term ongoing symptoms?
No, I don't at this point. I mean, we still follow up and we will tweak my medicine as needed. So Dr. Porter has given me some preventative medicine that we're hoping helps protect my heart and keep it functioning properly. Dr. Porter, you may have a different answer.
No, I have that answer. Becky, and it's, because Becky has a situation where the heart it's vulnerable, and anthracyclines have mechanisms that we don't fully understand, but we know that hearts are more vulnerable to weakening with other stresses. And when people have had this ejection fraction reduction, very commonly we find that they need to stay on these medications indefinitely because there is a chance it's not 100%, but I think Becky convinced herself that it's probably better to stay on the medicines than to come off them. And we don't really know, but there's been one study where they took people who were looking fine and they said, okay, well, we don't know that you need this long term. You're out for a year, maybe your heart, it's changed its evil ways, and it'll be good if you take the medicines away. And a disturbing number of people had a recurrence of their heart failure, and I've had people do that. And now that people ask me if, do I have to stay on this medicine the rest of my life? And my answer is, no, you don't have to. As soon as you don't care if your heart weakens and you go into heart failure, you can stop it. It's up to you, but I'd stay on it.
Right, that's honest.
Yeah.
Marie has a question for Becky. Marie writes, Becky seems so positive. Can you ask her how she told her children the news when she was first diagnosed? That's a good question.
Yes, we were, go ahead.
I was going to say, we actually have some awesome pictures of you and your kids and your family.
So how to tell a second grader and fourth grader that their mom has cancer was not any part of our plans. I had doctor's appointments for about a week, and I did my CT scan on a Friday night, or a late Friday afternoon. We had one of the kiddos' basketball games that night. My stepmom, who is a heart surgeon, asked for a copy of that, and she broke the news to me that night that I had cancer. And then we had a very busy weekend planned. So Saturday we had some volunteer work we were doing, and then we went to Great Wolf Lodge. So I was very thankful to have a distraction for 2 days before we really had to focus on what we were doing. So we enjoyed that time with the kids, knowing I would be sick for a while. And then that Sunday night, we sat both of them down and just said, hey, Mom has cancer. I'm going to go through lots of tests, and I'm going to be very sick for, the next 6 to 8 months or possibly longer. But, I'm going to survive. We're going to be there. And we will have our family to help us. My daughter, who was the second grader, I think immediately thought I was going to die because, when you're little and you hear cancer, you think that. We were also very blessed to have a very close friend who had a much more severe cancer diagnosis the year prior. So we had been helping her family all along, and we're friends with her. So it was kind of a preview for my kids a little bit, for better or for worse, as to, some of the process and what Lola's mom had encountered this last year might be some of the same things I was encountering. But Lola's mom is still here. Like
I can't imagine what that's like for a child to hear that. It sounds like you and your husband did everything right, and they absorb us. They're like sponges, right? So you exuding that positivity can only help them. Dr. Porter, Corey has a question for you. Corey has a question. Does cancer treatment put a strain on all hearts or just people with certain conditions?
Well, that's a great question, and the question actually includes two different answers to that. One is, do all treatments strain the heart? No, there are, well, a publication from last year listed 10 different classes of cancer therapies that have some toxicity, and there are different types of toxicity, but now, since that was published 18 months ago, there's two other drug classes that have appeared that do have different toxicities. So that area of the number of these drugs that have toxicities is growing, and the number of combinations of drugs that have toxicities that were developed to be and studied for heart toxicity as single agents are now being used in combinations. So I just saw a woman yesterday who had two options to treat her metastatic endometrial carcinoma after she'd already had heart failure and a mechanical heart valve put in and was on advanced pacemaker therapy to support heart function, and had a normal heart with some abnormal pressures, and she could either take adriamycin or go on to another form of treatment that has one component of elements of causing hypertension, elevations in blood pressure that could be dramatic and cause heart failure, and another type of drug called a checkpoint inhibitor that has about a 2% chance of causing myocarditis, but a 50% fatality rate.
My gosh.
They wanted me to kind of say, well, what do you think? Which do you want to do?
So what did you say?
Red Devil.
Red Devil.
Yeah.
It's always the Red Devil?
No, but it wasn't this, because since I've seen Becky, there's an approach to protecting people from adriamycin that is not FDA approved, but is clinically has clinical experience with it, and that's my approach now.
Okay.
That just wasn't. We weren't quite there with that treatment, 7 years ago. But there has been a change in our treatment. It's not driven by guidelines, but for people, around the country who are involved in this is a treatment of choice, to use a drug called Zenocard. It's a trade name, dexrazoxane. So it's upfront dexrazoxane would be what I would recommend now to Becky, along with what we did to support the heart slowly. We would give her that, and I'm using that fairly routinely now. Again, it's not FDA approved.
Emily has a question on one of our Facebook viewers. She wants me to ask you, how do you see the landscape of cardio-oncology changing over the next several years? That's an interesting question from Emily, because you're like a pioneer, Dr. Porter. You first in the region, you started the program here at the University of Kansas Health System. Do you see your specialty becoming more common and bigger?
It feels, I've gotten involved. I got involved in angioplasty before they had fellowships and before they were talking about interventional cardiology, and I helped start two heart transplant programs in the area, and I was interested in heart failure back in the 80s and transplant before the term transplant cardiologist. I was in a research group that coined the term transplant cardiology, which is now a common term. And this cardio-oncology feels to me the way heart failure specialists and transplant cardiology felt in the mid-1980s. An example, I went to the first, I'm working on the central leadership in this International Cardio-Oncology Society. And our first meeting was in Milan in 2009. I'd been to some other meetings at MD Anderson before then where I was getting this started, but we had a small group, and I organized a group photo because I'd seen other photos of heart failure groups in the early days, and I thought this would be a good thing. This is a seminal group, people from all over the world, small numbers. So we had all the speakers and all the guests, the audience on the podium, on the stage in Milan at this international, the European Cancer Institute there, and the video AV person took the photo. There's 50 heads.
Wow.
3 weeks ago, we had a meeting of the American College of Cardiology cardiac care of the cancer patient. There were 500 people and 500 registrants. So this has gone up a factor of 10 in 13 years, and it's going to continue to grow.
How did you decide to be a cardio-oncologist? I mean, how did you always want to do something hyper-specific?
No, I don't know. I just get. I mean, I still liked. I was interested in cancer treatment, and I was reading. There were 2 back-to-back articles about trastuzumab, Herceptin, which is a primary drug. It's one of the first targeted therapies that hit the market, and now there's a multitude of them. But there were 2 articles in New England Journal back-to-back about trastuzumab, and I just tuned in on the heart aspects of it.
Okay.
And I called Dr. Carol Fabian, who was the mainstay of the breast oncology program here for years. She's still active in research, but isn't doing her usual 60-hour work week anymore. But I called her and said, "Hey, Carol." And I known her. She'd been my attending when I was a resident. She's a couple of years older than me. I said, "Carol, this trastuzumab stuff looks like you're going to have some cardiac issues with it. If you ever need anybody to help you with that, I'll do that. It looks interesting, and I'll make some time." And she said, "Okay, I got 2 patients for you."
Wow. And that's how it started.
And it started out, and I'm not even sure the term cardio-oncology, it actually started, it was when we had our meeting in Italy, it was cardio-oncology, which is the Italian pronunciation, not cardio.
Cardio-oncology.
And so then it took a while for us to kind of, and there were Italians in the cancer center in Milan. Daniela Cardinale is one of the leading investigators in anthracyclines in the world, still is. She's kind of Yoda of adriamycin toxicity. And they were there, so it took a while to realize, oh, that's the Italian pronunciation.
We're talking in Italian.
We're going to go back to English.
Right.
We're not into foreign language. We pronounce it Versailles, Missouri.
Right,
we're not into French pronunciations of anything, and we're not. And so we said, okay, well, we're America. It's cardio-oncology. Yeah. That's the way it is. So
and there you go.
So it's just grown, and when you're by yourself and there's nobody to talk to in the area because nobody else was really doing it, and it's typical. All my friends who I talk to about this are in other countries. I've got a meeting. I've got a Zoom webinar today that we're going to be writing questions for the knowledge certification exam for cardio-oncology, and there's somebody in Milan and London
back to Italy.
East, right coast, left coast. So it's kind of a consortium of around the world people, because most of my best friends in this are not in Kansas City because I'm kind of alone in the area.
The trailblazer.
Yeah.
I have a question for Becky. This came from Joan. Joan wants to know, Becky, do you have any fun summer plans with your family? I mean, you are a go-getter, so I'd be stunned if you told me you didn't have some big adventure planned.
Well, we have to get the kids' schedules first.
Right.
But we definitely have 3 long weekends at Table Rock Lake, which is our favorite place to go.
That's your happy place?
Yes. We're hoping to go to Hawaii over Thanksgiving, so we're kind of pushing off a little bit of our summer plans, but I know we will definitely fit some other fun things in there as well.
I had a question from Gretchen, who wants to know if your experience has made you ask different questions at your children's doctor's appointments. Are you worried about their hearts? Does this make you do doctor's appointments differently?
We definitely make sure we share our health history, probably a little more than I would have in the past.
Would make sense.
The kiddos doctor is very awesome. Like she knew that I was sick. She was very kind as well in asking how I was doing and, if there was complications or if she could do anything for me as well. But definitely knows, some of the issues I've gone through and their with the kids, records and what we ask them about as well.
Becky, as we start to wrap up this conversation, I want to ask you if you have anything specific or a message that you want out there. One of the things that you've also shared is how grateful you were for your community and your church family and being able to keep the faith throughout all of this, in addition to the importance of women making their health a priority. What would be the takeaway you want people who are watching this to have?
A couple things. One, definitely go see your doctor. If nothing else, you have baseline results as to if anything changes. You can see that as you progress. Do not put yourself on the back burner, even though it's hard to, get out of all your work meetings. Two, definitely, I think you need to have a positive attitude. Which in my case was very easy. I had a very curable form of cancer. It didn't mean that it wasn't an awful, 7-8 months in there. But keeping a positive attitude definitely helped. I would not allow myself to go down the internet road of what happens with different cancers, what happens with different heart things. I relied upon my doctors to give me that information. If I had a setback, I allowed myself to wallow for that day. And then the next day was, okay, let's get back on track. This is what we have to do. If you can make it through checkpoint A, B, and C, you're going to get to a great outcome that's down the road.
Man, that's a good example for anyone who's going through something right now. Dr. Porter, do you have any final thoughts or messages?
I don't think so. I mean, I think, we've covered a lot of things. I can tell you that Becky's attitude is very important, and I ask an open-ended question to people when they come in, how are you doing? And if it's good or great, I move right along, but if it's okay, I guess, I stop because, first of all, I remind them, you're an outpatient, not an inpatient.
Right.
So don't forget that. You're not in the hospital. So what do we have to do to get you from okay, I guess, to good or great? And frequently there's an answer to that.
Yeah.
And people, if they're stuck in okay, I guess, or, Eeyore in life, it's harder. It's, they're not advocating for themselves.
Right.
They're not seeking ways to move forward. And it's just not, you've got to have internal push to get through all this stuff. It's not easy, and you can get into a rabbit hole. And I think people should understand that, in my experience, the number of people who have gone to Dr. Google and gotten better insight and comfort about their diagnosis is zero.
Right.
If you want to.
I've never felt better after Googling anything.
No, probably this week is not the miracle week to feel better when you Google things,
That's true.
So I think that you can get some information, but you don't get any insight from that. And I think, and now, with people have portals, and you can, send messages to your clinicians,
which is such a huge benefit.
And we,
yes.
I'll just say that all messaging from physicians is done on the physician's personal time. No health system, KU or anybody, allows physicians any time for patient messaging. That's all.
So when we get those responses from the doctors here, they're doing that from home or wherever?
Somewhere. That's
wow,
what's called.
I didn't know
that's
that.
what's called pajama time.
Right. Oh boy.
And all the results. I mean, most of the stuff we do. That's a separate talk. Okay,
Sure.
No health system wants to talk about how much unrecognized work physicians are doing. But you want to do that because you can. Most of the time,
Right.
there's a good answer, and people will feel better if they let themselves ask. Or they wonder, why don't they feel good instead of, I don't know, okay, I guess.
Well, I'm always amazed, and this is what I wanted to segue into when I talk to you about how much work you and our other doctors and nurses do. I'm stunned that you have the time to do what we're about to show our viewers. I want to take a minute just to share something that we've learned about you, Dr. Porter, behind the scenes, because when you're not a doctor saving people's lives, it turns out you're a super talented photographer, and you've been sharing pictures with me. Right now, your work is at the newly reopened Kansas City Museum. 4 pieces there that are on display.
Permanent.
That
exhibit.
is so cool, part of a permanent collection. You say that you got started with photography while you were on the yearbook staff when you started medical school here. So how do you have the time to do this? And did you always have a good eye for things? Because while you were also texting me and sending me pictures on cancer treatments, once in a while you'd send me a great picture of some scenery from a vacation with your wife in Mexico. And I'm thinking, this guy is never not doing something. How do you have the time to do this?
I don't know. You find the time.
And
I
you've
just
always
like
had
it.
the eye?
And I had the eye, and I think, and that's something that I don't know what that eye is, but I just see things differently. And I've got coaching. I've been working with a Pulitzer Prize-winning photographer for 14, nearly 15 years, Dan
Wow.
White here. So he's coached me along, and he's kind of my mentor in that. And I know when I'm taking photos, I'm always thinking, what would Dan be doing here? And I know that whenever I show him photos, he'll tell me, oh, well, I don't know why you're taking that. That was an area that's not interesting at all. You could have done this. Or he'll tell me, oh, that was really good. You needed to dig into that more. So even when I'm doing photography, I don't know whether that, I've got Dan White will be telling me I was wasting my time. It's boring, or you should have dug into it more. I'm never taking. It's just like when you're a med student and you're trying, you're in the operating room and you're retracting. The question is, am I pulling too hard or not hard enough? You're never doing it just right. So, but I don't know. I just see photos and I just see it, and I just I love to what I started with was just the idea of trying to find something beautiful in life and something interesting and compelling, and just trying to encapsulate that in a still photo. I started out, and I do a lot of candid street photography around the world, and I can tell you I got a good experience in medical school because when you're trying to get a photo of the say the vice chair of medicine when they're not in the mood to have their photo taken, that helps you deal with sailors in Turkey who you want to take a photo of. I mean, they're about equally unreceptive to having their picture taken. So
I love what you say about finding the joy, though, and that goes along with this whole show, which is Becky. Becky, you guys are so alike. You're right. If you were the kids on the back of the school bus, you would have gotten the same jokes, and Becky finds the joy in everything and somehow pushes through with her cancer journey and her heart journey. Did you know we also have some very talented artists as well at the University of Kansas Health System who are building some things? They were picked for the Parade of Hearts. In fact, we want to introduce you to one of our winners whose artwork is going on display very soon for Parade of Hearts. A special panel selected 154 winning designs out of 700 submissions across the whole metro area. Take a look at the one that was selected by our art therapist, Amy Eli Huxtable. Amy Eli Huxtable has lost track of how many Sharpies they've gone through while decorating their Parade of Hearts winning heart.
I wish I had started counting.
It's a painstaking process that the art therapist at the Marillac campus says is also a labor of love. Their winning Parade of Hearts design is titled Pride of the City. It's a tribute to the LGBTQ+ community and all the young people they've helped through their art therapy.
It's going to be the Kansas City skyline with kind of a rainbow spectrum of dots, kind of just to represent the LGBTQIA community in Kansas City.
The pointillism style representing individuals coming together.
I just want them to know that they're accepted and can be represented and that their voices can be heard.
3 months on display. Each heart, like Amy Eli Huxtable's, will be auctioned off to the highest bidder. Some of the money will go to the University of Kansas Health System's cardiovascular and cardiothoracic programs. It is just a great cause. And before we leave you this morning, we do have an important note from one of our nurse practitioners about knowing your risks when it comes to heart disease. Here's nurse practitioner Shirley Verbenek.
The most important numbers that you need to know are your family history, your cholesterol, your blood pressure, and your blood sugar. Know where you stand, know where your health is.
Thank you for joining us today on All Things Heart. Coming up next Thursday, we're 2 years into the pandemic. It is no secret many people have been drinking more than ever.
Oh, how it's wine o'clock somewhere.
You see that everywhere. Every shot, every drink, every beer, every glass of wine affects your heart. And with St. Patty's Day just around the corner, along with spring break, doctors even have a name for it. It's called Holiday Heart. You're going to hear from 2 cardiologists along with an addiction specialist on how to safely navigate through this month and avoid Holiday Heart. That's next Thursday morning at 10 o'clock. We'll see you then, and be sure to bring your questions.